Good afternoon, and welcome to the webinar. Today's webinar is titled Indie Practice Presents Don't Leave Your ASC or Ambulatory Surgery Center Rebates on the Table. The webinar is sponsored by the Medical Association of Georgia and Indie Practice. My name is Mark Maloney. I'm the CEO of VenOps. We do specialized compliance services for private practices from coast to coast. Our guests today are Vijay Reddy and Amit Malik. Vijay is the CEO of Cynthium Health, which he founded in 2013. If you have any questions, please put them in the chat and we'll catch them in the end of the webinar. The webinar is scheduled for 30 minutes. There'll be plenty of time for questions should you have any at the end. So Vijay, without further ado, the floor is yours.
Thank you, Mark. Thank you for the introduction and welcome to the webinar. My name is Vijay, as Mark introduced. I've been working in the health technology space for over 30 years. Started with a company called OSI Systems, which became or merged into MedAsset, and I built the revenue cycle management product line. And after that, I started my entrepreneurial journey, ventured into several healthcare enterprises, and finally started under Cynthium Health about 10 years or so back. And our recent project is rebates. You know, one of the things that I noticed while working in this industry is that the rebates, they go unclaimed. So I wanted to educate our audience and see, you know, if the money they potentially leaving on the table, you know, can be used to make sure your practice works more cash efficiently and so on. So I will introduce my partner, Amit, and he will give an intro and we will take it from there.
Thank you, Vijay. My name is Amit Malik. I've been in the healthcare industry for about 15 years now. I've worked for several hospitals and health systems, as well as consulted for hospitals and health systems across the country, including ambulatory surgery centers as well, primarily in the areas of supply chain, optimizing cost when it comes to medical devices, med-surg supply cost, and helping with things such as this, where it's helping to optimize the collections from rebates with the vendors and manufacturers of the implants and devices and supplies to really help the financial performance of surgery centers as well as hospitals and health systems.
Awesome. Thank you, Amit. And, you know, without much further ado, let me go through some of the information that we are eager to share with your audience. I hope you are able to see the screen. You know, as I mentioned in the title, you know, the surgery centers could be potentially leaving rebates that are, you know, due to them. So let's go over some of these topics. You know, this is the high-level summary of what we are trying to cover. And then, you know, as you potentially understand the market much better than what we do from outside. So what's happening, you know, why we are all here? Basically, you know, as every surgery center, we are under thinner margin and labor shortages, you know, that you're all familiar with. So there may be some potential opportunity that we may be leaving on the table, you know, due to various issues that you're already aware. You know, reimbursements are coming down, costs are going up, and pretty much rest of the things. So what we see, based on the industry stats, surgery centers could be losing some money in terms of claiming the rebates, uh, and due to various reasons, one of them being it's very hard to track due to uh, the purchases happen through reps or some other challenges, so it's time consuming. And the rebate process is fairly complex in terms of the agreements and so on. So we thought, we can help you guys with a system that pretty much automates, not exactly automates, it's more of a collaborative. We cannot um, completely, do like a black box, outside of your system. We have to work collectively to bring about, potential opportunities that you could be missing. So that's what this is about, and then these rebates can add up, and some of them could be leaving anywhere from 15% to 25% on the table that are potentially due to them without having to look for additional sources. So again, the problem is, as we highlighted, uh, the potential opportunity is there for ambulatory surgery centers. It could be depending on the number of processes that you follow, you perform on a daily basis. So, and again, as in point number two, manual reporting processes can catch 70 to 80%, and then that could potentially leave 20 to 30% that go unclaimed. So that's high level issue that we are facing, and the impact on these unclaimed rebates can not only affect your bottom line on a short-term basis, but also long-term. This is an ongoing process to make sure that you capture what is due to you. So that's what uh, we thought we could bring together an opportunity, uh, to collaborate on making this a win-win solution for both of us. So again, Cynthium Health with AI powered platforms can streamline these capturing the data and all the other kinds of missed opportunities. But this is something that has to be together. It's a collaborative effort that collectively look for opportunities. So how the solution works is, we initially try to onboard and by reviewing the contracts that you have and leverage the AI and go through the data and work with your team to map certain data elements and and capture all the combined revenue, surgical procedures and stuff, and we'll take it from there. So that's basically collaborative effort that we need to work together to make this happen. So, and this is not one-time job. It's an ongoing task where we have to work together, continuously track the purchases and the contracts. They can be changing on a periodic basis and identify those claims and submit to the manufacturer and then sometimes they can be once in 3 months or once in a half a yearly or yearly kind of rebate, and then extract what is potentially yours. So this is about a case study that we have done recently. Amit can answer some of these questions. But this is about a surgery center, that can be, through efforts like constantly tracking and things of that nature, we were able to achieve 24% increase in recovery rate and also streamline some of these operations. So anyway, this is again high level information, and then how we can make it a win-win situation is we wanted a more strategic long-term opportunity to work with these surgery centers on a success-based shared model where you get to keep 60-70% for anything that we were able to uncover, and then the remaining 30% is Cynthium's share, and then we keep everything transparent. There is no upfront cost except a small setup fee that's purely going towards establishing the systems, understanding your back end, extract the data, setting up the pipelines and things of that nature. So it's a truly win-win situation for both of us. And I would like to take question and answers. Amit is here to answer any questions. And yeah, you're ready to take any questions at this time.
Oh, thank you, Vijay. This is Mark. I don't see any questions yet in the chat, but I've got a few that I think may be fairly commonly shared. What are the medical specialties or the medical specialties within the ASC that tend to have the highest return, in your opinion?
My opinion, mostly like orthopedics, as well as anywhere there's surgical implants are used. Cardiology is one, but I would say orthopedics is the highest. And Amit, do you want to add anything to it?
So orthopedic and cardiology are two.
Yeah, any surgery center, that does use these implants with complex contract with the rebates agreements. For example, if you buy a particular group of products within a certain time period, you will get 10% off, cashback or things like that.
So every time I talk to a practice from a perspective of indie practice to help create new revenue or save revenue, a common question from the administrator or the owner is, how much juice for the squeeze, which would be another way of putting it, is the result worth the effort? And in your use case of $50,000 to $150,000, certainly it sounds very much worth it. What is the time frame from the beginning of the sort of investigation to the return typically?
Initially, most of the effort is on massaging or mapping the data, analyzing the patterns, what group of purchases that are done. We can also help with procurement related tracking if that is what is needed. But either case, the initial first, I would say, couple of months is more on the system engineering and understanding with your procurement staff and getting to know the data better. But I would say it would take 3 months, and going forward, you will start receiving the benefits from it.
Very good.
Not
And
only that, but also sometimes you are on the verge. Let's say you purchased a particular group, let's say 10,000 units. That is agreement. Sorry to interrupt you. That is like a contractual volume, and then you are at 999,000, let's say. So you are a threshold away from reaching your target. So those are the opportunities that you could have missed out unless you keep tracking on a regular basis. So those are the opportunities that we can bring, even though that is one device, but it can have, let's say, 5% cash back on the entire 10,000 units. That's a big number.
yes, how much work is generally required on the part of the staff besides giving you access?
As far as work-wise, I would say, limited. We need the knowledge in terms of, when we have questions, we have the subject matter experts who are going through the data. But we do need input. We cannot work in a vacuum, but we do need certain input from time to time. But we will keep it at a very minimal. Yeah, I hope
Very good. And there's no upfront cost. The only revenue model consists of if you find unclaimed rebates. Is that correct?
Yes. Only through our efforts if we claim rebate successfully from the manufacturer. That's the money that you do not have it. You get to keep 70% of it.
And let's see. I think those are all of the questions I have, and those may cover most of the comment. I don't see any other questions in the chat. So do you have anything else you want to add before we close the webinar for today? And I thank you very much for your contribution.
I would say the next step being, we will reach out to you guys and see if it's something that times fits in your organization. And then we can have a one-on-one session to explore the opportunity together. And then, again, since this is a no cost to you, and I believe that this can be very cost effective in addition to what it can bring to the table. So you have nothing to lose. Most of the effort is on our side of the thing. So I would say, feel free to schedule a meeting with us, with your team, and we look forward to talking with you.
Very good. Thank you, Vijay. And if anyone has a desire to schedule a meeting, you can contact us at info at venops.com, and Venops is spelled V like Victor, ENOPS. And Vijay, what is your email again?
It's Vijay, VIJAY at synthiumhealth.com.
I'm going to put that in the chat right now.
Yeah, I will also give a Calendly link. Let me just a moment. So,
Are you going to put that in the chat?
in the chat, I was hoping, but let's see, it won't. Yeah, Calendly Synthium study.
Outstanding.
Yeah. So that's the Calendly link. You can directly schedule it over there, or you can send me an email, vijay@synthiumhealth.com, and we'll be glad to talk and answer any questions that you might have, and hopefully we'll be able to help you improve your cash flow.
There was one question I was going to ask you, and that is, This is the first time, this is the first service like this that I personally have come across. I was wondering, is this something that is fairly unique to your company? Do you have a lot of competition in this? This is a first for me.
I believe it's fairly unique. We came across this opportunity. I have some board members from Medtronics and things like that, and they do. I hear from them that some of these contracts are pretty complex, and and also they again some of the confidential information I probably don't have to share. But I do hear this is the contracts and pricing for medical implants is fairly involved. So even for them, sometimes it's difficult to keep track of what is what went under which contract, whether GPO involved or whether this is involved, how it is involved. So
Understand.
but again, those are the challenges that I hear from time to time. So finally thought, let's make it automated, use AI, and these days AI is fairly ingrained in everything that we do these days. So then, yeah, here we are.
Thank you very much. I wish everybody a good day. Take care.
Thank you all, and I appreciate your time, and I look forward to talking with you.